The National Senior Citizen Center, in collaboration with the Federal Ministry of Health and Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development, have engaged stakeholders on a two-day meeting on validation of draft national benchmark statements and minimum standards in the curriculum for training older people caregivers. Speaking at the event, the Director General, National Senior Citizen Center, Ogmakaro, said the take-home from the review meeting is to increase the national standard and effective service delivery for older people across the country. Clearview News' Imofon Okon was there and now tells us more.
The review of amendments draft to national benchmark statements and minimum standards in curriculum for training older people caregivers, according to the Director General, National Senior Citizen Center, Ememo Makero, and the coordinating consultant of the Nscc, Ndayo Iwot, aims at developing compliance measures in line with the world standards.
What we are taking away is that Nscc with its partners, you've seen all the consultants, you've seen all the professional associates, nobody's left out. You've seen the MDAs, everybody having a role to play. The takeaway at the end of it is that we should be able to produce a global standard document that will emphasize skills and competency in care of older persons and that can stand up to the best practice and then put in place, mechanisms for assessing. You assess the trainers, you assess the training centers, you assess, how you evaluate, So it's a whole industry mechanism that we are putting in place.
Certification of care agency, training agencies for the first instance, then the care agencies and facilities. So those guidelines are there. And we are also going to look at the curricula for training. So what are we producing? The philosophy, the synopsis of all the modules, and you are diving down to know what will be the outcome of these trainings.
Other stakeholders at the meeting offered their wealth of experience on how to better manage older persons and said it's imperative for everyone to have basic knowledge on how to provide quality care service delivery to persons in the category.
So all those kind of things, now we will now know that old people are a very special group of people that all of us should actually know how best to care for them. And we need to standardize this in country. And that's why the Federal Minister of Health, working closely with the Nscc, actually coming up with these guidelines. So we are 100% in support of this because it will help us to know the basic line.
The ministry, in collaboration with the Federal Minister of Health, National Health Insurance Act, and other critical stakeholders, is in the process of developing a framework of Health Insurance Act for older persons, which will also provide them access to basic health care and financial protection.
The NHIA Act provides for mandatory health insurance, for financial access to quality health care for all Nigerians and legal residents. This does not exclude the elderly.
The meeting is a follow-up to the National Senior Citizen Center stakeholders' engagement on the development of a national benchmark statement and minimum standards in the curriculum for training caregivers. Imefon Okon reporting for Clearview News.